Today I will be performing an oral exam on Midnight. She's a spayed female lab border collie cross and she is 10 years old. I will start with the extra oral portion of the exam and begin by determining skull type. Midnight's a metacephalic skull type, and we determine skull type because certain skull types have different dental diseases. Brachycephalic patients tend to have more oral problems. Next, I will look at face symmetry and look for evidence of facial swelling. I look for any congenital or hereditary deformities in the face as well as any muscle wasting. Facial swelling could indicate infection in the mouth or tumors. You need to pay special attention over the area of the fourth premolars and the maxilla. This is especially important in dogs as those teeth can abscess. Oh girl, stop. So next I will check the lymph nodes and salivary glands. With the lymph nodes, I look for any enlargement and pain, which can indicate dental infection. In the salivary glands, I look for atrophy or enlargement as well as any defects. Next, I look at the eyes and nose. With the eyes, I make sure they are all of equal size and that there's no protuberance of the eyes. A distal infection in the mouth can cause protuberance and discharge of the eyes. If there's discharge, I look to see what kind of discharge it is. If it's thick and colored, this can mean infection. Discharge from the nose can indicate abscess in the maxillary teeth. I examine the lips next for any lesions, wounds, infections, or tumors. Okay, the last thing I look at during the extraoral exam is checking the temporomandibular joint. The TMJ is where the maxilla and mandible join. With the TMJ, I'm checking for pain and limitation when opening the mouth. I open it as far as I can to check for limitation and to see if there is lockjaw. I also look for crepitus. So after I do the extraoral exam, I do the initial oral exam. I can't do a detailed exam until Midnight is anesthetized, but I can look for pathology. I will start with the occlusion of her jaw, and this is only done while the animal is awake, as the endotracheal tube is in the way of the animal's normal occlusion. So first I look at the incisors, and the maxillary incisors should sit rostral to the mandibular incisors, which hers do. Her canines, her mandibular canine should sit between her maxillary canines and her third incisors, and hers do that as well. Her maxillary premolars should sit in between the groove of the two premolars on the mandible, and hers sit like that as well. And then I look at the carnasal teeth, which is the maxillary fourth premolar and the mandibular first molar. Her maxillary fourth premolar should cover her first molar on the mandible, and Midnight's do that as well. So she has no malocclusions. After I look at the occlusion, I look at the mucous membranes. Okay. I check for evenness of the color itself, and the moistness. I also look for ulcerations, lacerations, swelling, and foreign bodies. Next, I look at the gingiva around the teeth. I look for the normal placement of the gingiva. There can be hyperplasia, which is where the gingiva grows further onto the tooth than it should, or there can be recession, where the gingiva has been lost and more tooth is showing than it should. I look for any swelling or bleeding of the gingiva and the color. Okay. I use a Q-tip to check for any painful areas around the gum line. Feels weird, doesn't it? Good girl. Good girl. Okay. This is especially important in cats because they can develop resorptive lesions, which are like cavities. The gingiva grows into that cavity and is very painful. So next I count all the teeth to make sure she has them all and that there aren't any missing or extra teeth. Adult dogs like Midnight should have 42 teeth. there should be 3 incisors, 1 canine, 4 premolars, and 2 molars on the maxilla on both sides. Yes. So Midnight has all her teeth on her maxilla. On the mandible, she should have 3 incisors, a canine, 4 premolars, and 3 molars on both sides. Midnight, stop. So Midnight has all her teeth on her mandible as well. If there are any missing teeth, you can ask the owner to do radiographs ahead of time before finding this information while the animal is anesthetized. The last couple things I look at are the tongue and the palate. With the tongue, I look at the general appearance. I look for lesions, tumors under the tongue, and swelling of the salivary duct, which is called a ranula. I know you don't like this stick. Oh, she's not even going to let me with her mouth. Okay. Come here. Be a good girl. She's like, I'm done. Stop. Okay. With the palate, I look for defects, foreign bodies, and swelling. With large dogs, this is especially important as they can get sticks and other objects stuck to the roof of their mouth. Okay. In conclusion, Midnight does not seem to have any infections. She doesn't have any problems with her TMJ. And she has no malocclusions. She has all her teeth and no extra teeth. She has some gingivitis and a lot of calculus on her premolars and molars that can be graded while she's anesthetized.